Hi everyone. There's a specific purpose why I've come and connecting with you all. After my right brain approach, I'm sure there must be thought in your mind that now when I have announced my book and my further teaching of case taking in difficult condition, I'm sure thoughts in your mind is what it is, how I will be taking this journey further. So let me connect with you and explain you what I'm going to do in this whole journey, or what I do actually, you know, in such condition. This time I'm focusing on case witnessing in difficult condition, a specific module, a specific module in psychiatry, deep pathology, coma, organ transplant, people who are stuck with low level of experience, belief system, one-sided disease, and retake. This is case-taking module, and then how to select or a specific posology module, its general concept, and specific posology module in such difficult condition. Before going deeper, I just want to explain that how this came into existence. As you all are aware of my 3 steps of case taking, a simple, scientific, reproducible case taking module, which I call case witnessing module, a module in which 3 basic steps, where in a first step you give open space, ask open non-leading question specific to the age, specific to the stages of that person. Then once they stop, you guide them in different stages, different situations, in their personal professional life, and then in their subconscious, like fear, dreams, imagination, daydream, art, interest, hobbies, etc. Then you guide them in illness. And based on this, yeah, then you select the PQRS which are coming, and amongst those PQRS, there is one or two, a group of PQRS which are holistic. And base what I call master key. Based on that, you start active and active case witnessing process, where first you get hold of master key. Make sure that your master key or holistic PQRS are on the right track and perfect. Then you start the third step, what I call active, where you zoom in and understand that key as completely as possible, where all the other PQRS are in tune with that key. And I'm sure I'm using this for last 21 years. Then the next question came as, what about children, where they don't talk about different stage different situation and also illness. How are you going to do their case taking? And that's where the specific child centric case taking module was designed in my book, A Wonder with a Little Wonder, Child Centric Case Witnessing Process, where I spoke about a module of case taking in children. Children, imaginary age, children, teenage. And yeah, and then the specific, this 3 step of case taking was specifically done with a child centric module. Like you see, that it's when we asked them a question, the questions in an open space was asked according to their age. Then the guided areas were selected, like fear, dreams, interest, hobbies, art, artistic, unique questions, or guided methods, and specific child-centric diary to get their PQRS. Once you get again the step 2 active and active based on child-centric areas. It worked very well. Then, of course, since then, the other module of case taking, like the case taking module in uniquely able children, non-verbal children like autistic spectrum, the learning disorder, cerebral palsy, and all, how the 5-step module of case taking was proposed, and how those questions which were designed in those 5 areas were based on the child natural energy, whether physician's observation, parents' observation, mother's history during pregnancy, yeah, and physician's examination, and finally a peculiars which were running in 2 or more than 2 areas, whether verbal or non-verbal energy symptoms. After that, I developed a module called acute case taking module. That how in acute case taking, you need to focus on present predominant picture with a change at mental, physical, particular illness, investigation, and holistic level. So the module was 2-step centric, and within 15 to 20 minutes, you can zoom in into all the PQRS at particular general, mental, and holistic level with specific artistic questions, guided artistic questions, yeah, guided artistic method to get more better picture in the children. Even the children during epidemic and pandemic, a specific module and questions which can guide us to get the picture out. And in this children, the acute centric diary, which works very well. I started studying the remedies of all acute at a whole level, then the posology in the acute. After that, I started working on a next book called Case Witnessing or Case Taking in Difficult Condition and Situation, which I almost finished, like in cancer cases, psychiatric cases, organ transplant, non-verbal children. But I didn't publish. As you know, that the question came up that time, that in spite of such foolproof, simple, scientific, reproducible system, why still the failures are coming? And failures, especially in people who know, people who have very strong learned logical brain, like homeopaths, doctors, psychiatrists, like that. And then I realized that though I have a foolproof, simple, scientific module of case taking, the natural, spontaneous module, where the natural PQRS, spontaneous PQRS are missing. And that's why people gives me particular, general, mental, holistic, but all coming from the logical mind and not from the natural, spontaneous, unique center of them or an individualistic center. So in a way, I was getting all book picture. I was not sure. And that is the reason where I wrote a book called The Right Brain Approach in Homeopathy, where a module of case taking was proposed, which can be used along with simple scientific reproducible module, where all the questions you design, artistic questions, unique question, and all the method you use, guided method, according to age, according to different stages of their life, and according to the area which can directly take them to the spontaneous brain. And then I started applying this in my normal module of case taking. This became one more hint, one more area to be sure that the PQRS what I'm getting or characteristic I'm getting coming from the spontaneous, natural, individualistic center and not from the any other center. It worked very well for last 7 to 8 years, and that's where I published this book, and I'm sure many of you have this book. Then once this is done, the deeper questions started coming, especially from, since it's a right brain, it looks like artistic, spontaneous, natural, a book which is, abstract artistic ideas. My classical minded friends, my classical teachers, friends, homeopaths started question, and even my left logical brain, that now how will you do case taking in difficult condition, difficult situations? Yeah, and this is where this whole journey what I'm going to teach you here started. I started working on one by one module. The first thing I understood, and the first thing when I say case taking in difficult condition, the first thing I talk is that how there is a problem with the existing module of case taking. How the existing module, which is one book centric, one person centric, yeah, one system, one method, one approach centric. When we put everything from that module perspective, it works, but the patient is not one book, one person, one system, one method, one module oriented. What I understood that what we need is a paradigm shift from one-dimensional fixed approach to multi-dimensional integrative holistic approach in homeopathy. And what I mean by this, that whether I study a remedy, whether I do a case taking, whether the case taking in difficult condition, yeah, whether it is follow-up criteria or posology, I need integrative, multi-dimensional, holistic approach. And this worked very well and with specific in specific condition. Yeah, and that's what I started practicing. A multi-dimensional holistic module to find the master key in patient or a master key in remedy. Yeah. Now, after doing this, now we talk about one that when I talk about this module, what I talk about. Yeah. Let's start with first that when I talk about psychiatric module, what I talk about there. The whole, when I keep psychiatric cases in front of my eyes, the first thing which comes up that how do the most of the psychiatric patients are stuck with mental symptoms, mental delusion. Are this delusion are of homeopathic importance or they are just disease symptom? Second, most of the mental diseases patient are stuck in what we call one-sided disease. So the question comes up in the mind in such module, yeah, is A, how to differentiate between disease delusion and the characteristic homeopathic centric delusion. How to take case of a psychiatric diseases which is either acute, chronic, psychosomatic or somatopsychic. How each one needs a specific module of case taking to get the PQRS at both mental and physical level, at holistic level. So in this module, what I will be talking about is the whole concept of psychiatric disease as I understand. The different types of psychiatric disease, acute, chronic, somatopsychic, psychosomatic, yeah. Then the 4 area-centric case-taking module. Artistic, unique questions and methods which are applicable to psychiatric patients. Then the psychiatric-centric diary, which will help this patient to note down in a specific section with a specific questions and a method all their PQRS. How to check the posology in such cases, whether acute, chronic, somatopsychic, psychosomatic, or pure psychic, pure emotional oriented diseases. Yeah. Then we will be seeing 3 cases, at least 3 time permits, one of a bipolar disorder, how to demonstrate this model to understand what shift can possible in such cases. Yeah, and then how that disease can be a gift. Then acute case of Stenthal syndrome. You will love this case. Yeah. And then, if time permits, acute case of an acute psychosis, where the patient went into whole acute psychosis of various delusion, including that he is the bloodline of the Messiah or a prophet. We will end this module with an understanding that how disease is a gift. And if you stay with the disease, yeah, the disease itself can become a remedy. With an example of a Japanese artist, Kusama, how she made her disease as her gift, and how by staying with her disease, she gradually not only came out of the disease, but she became the famous artist. Yeah. Now, next I'll take you to. So when I teach pathology, I think this is one of the area which I personally believe every holistic minded homeopath should teach, and this is their best gift. I know I'm saying other way around. You believe that no, the pathologic centric homeopath should treat, but no, it's other way around. So in this module, what I teach, when I teach about pathology, first I teach about actually my quest for pathologic centric similimum. That how whole journey of my life in the last 25 years, it is centered around deep pathology, understanding it. Yeah. In this module, generally what I teach is the whole integrative holistic concept. A module which is based on exploring 2 states of people. Based on present predominant pathological state and persistent constitutional state. Yeah. A 2 state which comes either from an external causing an impression of them, which is present predominant state, and internal, their own constitutional state bringing the pathology. And so you do case-taking, or a case-taking module is also based on a 2 state. So you have 2 separate module you do. And then you make totalities which are 2 based on present predominant pathological state and a persistent constitutional state. Then Along with this, specific what I teach in this module is how to explore location, sensation, modality, and concomitant in an what to ask in them, then what to ask, artistic, unique questions and module centered around pathology. Then the pathology centric designer diary with the various sections with artistic questions and method to bring out their state more and more. Yeah. Then a posology module centered around deep pathology, when to use mother tincture to 12C, when to use 32 mm, and when to use LM in deep pathology based on scientific, homeopathic, holistic principles. Not only this, in this model especially, I'll be talking about autoimmune disorder. Yeah, a module which I proposed and I taught along with my other esteemed teachers and friends like Yakir, Dr. Sankaran, Dr. Sankaran, Massimo, Dr. Farokh Master, and various other teachers in Munich, where I spoke about deep pathology centric module with autoimmune disorder, where case taking I already told you, where how to study autoimmune centric remedies, how to study them by keeping in center the autoimmunity and understand through that perspective. Let me give you an example. For example, we have two immunity, innate immunity, adaptive immunity. The first line of defense we call innate immunity, which has many cells, as you see, neutrophils, basophils, eosinophils, macrophages, dendrite cell, mast cells, natural killer cells. Yeah, and the first immunity is phagocytosis by in all these cells are called phagocytes. So do you know any remedy from this perspective if the immunity is involved and the innate immunity and phagocytosis? Naturally, yeah, you will think. But if you read a remedy called vanadium from your boric, it's mentioned increase and stimulates phagocytes. Like that, many other remedies like echinacea, eupatorium perfoliatum, viscum album speaks about this. Just some example. So that way, every aspect of immunity, you can, from a homeopathic perspective, you can understand. So the various autoimmune disorder and what involves in that, you can trace back to a remedy beautifully. Not only at pathology level, immunity level, at holistic level. I personally believe this way you will understand that remedy that at the disease level, but also at a whole level. So this is the journey. I will take you to various such remedies centered around autoimmune disorder in this module. Yeah. With specific cases, case of a with case of a autoimmune rheumatoid arthritis, bad. A case of a vitiligo and alopecia totalis since birth. And how understanding the module of case taking, module of totality making, module of remedy selection, and module of diary, we understand and follow criteria, we understand these cases. And if time permits, we will do a case of a Sjogren's syndrome, where how the practical school and the holistic school both can teach each other and both can make each other complete. Yeah, this is the best example which will give us that idea. Perfect. The third module which I'm teach is the module of a case taking in organ transplant cases. Yesterday, I was reading a book called Curious History of the Heart. And they gave a lovely example right in the beginning of a heart transplant case where an athlete who died in an accident the heart was transplanted in a girl. And they studied this kind of cases. So this girl, she started thinking, feeling, perceiving, sensing, and reacting like that of that athlete, like a man, like that athlete, that specific individual energy of that person, as if it has come through heart in her, and she became. Very interesting and similar, many examples I can give you, including many of my patients. So the question here is, can we treat organ transplant cases in the same way the way we treat normal cases? Don't you think that in an organ transplant cases, at the time of transplant, around that, there may be a different state? So they may have two different states, their own constitutional state and a state which the organ is carrying. Then naturally in such cases, my specific what module I need to design, that I need to have a two-state case-taking module, what we call present predominant organ transplant state and a constitutional state. Yeah, then I need totality in two way. Then accordingly, my remedy search posology based on that. Such people, in order to suppress this state, are on strong immunosuppressive and steroid medicine. So how to balance that? In such patients, since they are carrying another organ, another energy, along with homeopathy, how our patient-centric, organ transplant-centric homeopathic suggestions, how organ-centric diary should be made so that they make in a way friendship with that organ, or that organ get in tune with their own energy. It's a lovely journey, in such patients. So those artistic questions, those artistic diaries, questions to accept this organ. So this is what I talk in this module. Next. So this I have few cases of kidney transplant where luckily both the donor and the recipient were my patient. So I know both the state. I know during the transplant state and after. So it'll be a perfect to discuss either one case, yeah, to understand the whole theory with practical example. Perfect. Now, the module which are close to my heart is this kind of module. One-sided disease. We have spoken a lot in Organon about it. But what comes up in our mind that we generally say the one-sided disease means only practical school can handle it. Only based on practical remedies, organ-centric or the disease-centric remedy. But in one-sided disease where people are stuck in one state, one stage of their life or one disease organ-oriented state, how to do case taking with exact questions at that state, that situation or that disease with location, sensation, modality and concomitant. You ask appropriate uh, questions, then artistic, unique questions and method where not only the one-sided state completely comes out, but that also gives a way to complete from one-sided to get their whole holistic state. Second, in such cases, that how the follow-up should be designed in a specific way so that not only you take the follow-up, but in every follow-up you explore one more state, situation or area in this patient's life and guide them with specific question so that you get more information about different stage, different situations, and conscious subconscious area to complete this case. So through follow-up, how to complete one-sided diseases. Third, through specific one-sided disease diary, how to help them, to help us to move from one-sided totality to holistic, complete totality. In the diary, what sections, what questions, what method to add. And the last part, the specific posology, because they are stuck at the one-sided. Why in such cases, mother tincture to 12C or LM1 to LM12 are the posology which are indicated. Why and which one we'll talk about. So this is what is the whole one-sided disease module, which I like that, and our classical homeopath and especially from practical school will love this. The next one, but before go to the next one, we will study this with a bad non-healing bone fracture and non-healing wound for 1 year with complete year on antibiotic. How this case with came up only in one area, one what we call one-sided disease perspective, and how what we did case taking wise, remedy selection wise, posology wise, and what changes happened. Then, now this module, I'm convinced, whichever school you belong to, however number of years you have practiced, out of our 10 cases, 4 to 6 cases are stuck at low level of experience. And many people for last 21 years, when I'm developing a case taking, a constant, persistent question which comes up is, do you have a module for people who are stuck with low level of experience? People who are stuck with disease, people who are stuck with common emotions, people who are stuck with day-to-day situations like personal, house situation or professional situation, and they only talk about that. People who are stuck with common human emotions, they only talk anxiety, fear, sadness, that's it, and not beyond. How to do case taking in such people? Second, how to do case taking in people who are just stuck at their one ages. They only talk about childhood, teenage, middle age, old age, but only situations. Or people who are stuck in the belief system, a one particular belief system. They are stuck and they only talk about the language of that belief system and not characteristic. Trust me, in such cases, there are lovely questions which can be designed, which these people only understand. Let me give you an example. For example, a housewife coming to you, Indian housewife especially, stuck only in the stages of the life. You see how many questions I can design in such woman. That childhood, before menses, after first menses, after first, around first menses, yeah, before, during, and after marriage, before, during, and after childbirth, before, during, after grandchild's birth, before, during, after menopause. These are very important stages of woman's life, and they can clearly remember the changes they are going through that time if we design appropriate questions. In fact, you're having 10 different stages. Lot of PQRS will come. Just a simple example I'm giving you. Yeah. So I think this is, if you ask me, which are my best cases nowadays, is those people who are stuck at the situation, low level of experience, common emotion in different stages of their life or belief system. What earlier we thought the worst case, now they turned out to be the best case. Only thing, you should know what question to ask. Yeah, so I look forward to talk about this with all of you. Then, naturally, the next most difficult module, which was difficult to design, because you are talking about coma. And in coma, patient is in coma. So you don't have, only thing is the observation. but that many masters have talked about us, have spoken to us about. So in such coma cases, what concept here, case-taking module, what questions you can design so that the caretaker, relatives and all gives us patient-centric characteristic and not their own imagination. How you can take help of hospitalization, investigations, and understand that person well. How you can take help of that specific coma, the pathology of coma, and understand the characteristics. This is all, yeah. And in such cases, what posology, how to do follow-up. We will do this with a case of a post-operative coma where, yeah, patient went into coma after adenomyosis operation due to the hypoxia, hypoxic ischemia, encephalopathy, which damaged the patient's basal ganglion. Now, many times for last 21 years, people talk about failure cases. In fact, today what I am because of talking about failure cases right in the beginning of my life with my very close 12 to 15 people every 2 to 3 months. Used to be a group called Your Failure Case and My Answer. Now, in failure cases or a retake, the problem is you have taken the case and you are taking the retake. If you have the same mindset, end result would be same. You may have a different remedy. Mind you, you may have a different remedy, but the end result would be the same. Then definitely the retake should be more scientific. The whole aim of retake, when you design a retake module, questions should be such where this time they take you more close to the more accurate similimum remedy. Every time you do retake, you should be more closer and not any other remedy. So that's what in last 5 years I was working on. The whole case-taking module, that when you reassess how you design your 3 steps of case-taking in such a way that it is more patient-centric, more it goes to the PQRS and holistic of the natural holistic of the patient. Yeah. Then when you take the previous history of the patient into account, what you ask about it and what you take, that's also very scientific. How you design every stage of the case taking with normal questioning, artistic questions, and method, so that this time they go more deeper. The idea is that take 2 or a retake should be more deeper. All the set of questions and the way I do, I'm convinced it'll help you, that it'll take away from what you do and actually what is needed there. In this case, the whole, so how to make totality, which data from the previous interview to take, and a unique patient-centric diary for retake, so that you prepare them what to answer you. And yeah, then the retake, because we are discussing about deep difficult condition, that how to do retake in deep pathological cases, psychiatric cases, one-sided cases, yeah, non-verbal cases, like that. So specific questions and specific module. So this way will help you. Yeah, and we will end with a case, or maybe one of the case I will select, yeah, where one retake or two retake is done, and to explain the whole module, a case of embolism, yeah, or a case of a high prolactin level, yeah, to explain you that what we do in retake and why we do. Now, when I say posology, what I mean is scientific, integrative, holistic concept of posology. We have three group of posology mainly. 32 mm, mother tincture to 12C, LM1 to LM12. Right? The question is how to use them on our integrative holistic principle. There are many questions which comes up. If you look from one book, one person, one system, one method oriented homeopathy, then each method person or each system person speak about different posology and different way of using it. Right from the classical Hahnemannian era to Kantian to Boger to Clark, each one spoke about different posology group and different way of using them. Hahnemannian restricted themselves to 12, 18, 24, 30 and later LM. Kantian, they started with 10M. Boger, Boningausen, Boger especially started directly from MM. Or boric mother tincture to 30. For each one of them, the concept of the high and the low was different. For Hahnemannian, it was low means mother tincture to 3C and high means 9, 12, 18, 30, 24 and 30. And Kantian, low means 30 and high means 200, 1M, 10M and further. For each group, the repetition was different. Some suggested one dose, wait for 30 days, 60 days, specific days. Some suggested repeated doses. Some suggested deep pathology, low posology, and some suggested high and repeated, like Stuart Claus. So what I'm trying to say that how to move from a one concept, one disease, one person, one method, one system oriented posology understanding to real scientific based on individualistic, holistic, integrative approach. I am convinced if you understand the principles well, any school you belong to, the module which I'm proposing will touch your heart. And it's an open invitation. Any school you belong to, any idea you have of posology, come and just witness. It will really give you that depth. Yeah. So what, and especially even in this such condition, difficult condition, different people are talking about different non-verbal children. Each one has their own idea of posology. More difficult the condition, more abstract idea, and we have forgotten the principle, whether deep pathology or psychiatric or one-sided disease or coma and organ transplant. So we will talk about how to apply a simple scientific integrative posology module in such condition. Yeah, like this, that we will discuss a whole schema of posology selection. 3 group, when and how and which one, whether in acute, yeah, or whether in our difficult condition. The whole schema chart, which has been, I've already spoken on many schools, including Misha Nolan School in UK and many other international school, and they have spoken very high about it. So I invite you for this simple, scientific, integrative, holistic posology module. If further, if I want to say, I will also discuss about the simple scientific module of repetition, change of posology, and specific areas where you can use 2 posology of the same remedy, and another specific situations where you can use homeopathic posology along with other alternative medicines like Bach flower, etc., or the Suzeless salt. How to combine them based on the again principles of homeopathy. Yeah. So I look forward to talk about this simple, scientific, reproducible, integrative, holistic posology. Yeah. Which one? How much? When to repeat? When to change? When to give to? And when to combine with other holistic medicine. Yeah. Perfect. So this is all what I'll be doing in this module of case taking in difficult conditions. I invite all of you to join me in this journey. So if you think that this concept are close to your heart, and you think that the way I've made justice to the case taking process for last 22 years, then please join me. Yeah, and together I'm convinced we'll understand this case taking in difficult condition, posology in difficult condition. It does not matter which school we belong to. And in this journey, when I wrote to my very close friends this desire that I'm talking about and writing about case taking in difficult condition, my very close friends and colleagues and teachers like Jeremy, Yakir, Massimo Mangilavori, and now Manish Bhatia and many others unconditionally decided to join with me in this journey. So it's really, so if you have liked my case witnessing process, the scientifically intuitive case witnessing process, the journey of 3 steps, if you have enjoyed the child-centric case witnessing process with me, if you have enjoyed the right brain approach in homeopathy with me, then I am convinced you will enjoy this journey as deep as this earlier journey. Thank you.